Hello, everyone, and welcome to my symposium on dehydration. So I picked the topic of dehydration and also how dehydration affects exercise and exercise ability. So we talk about dehydration in terms of water loss from the body. It is also coinciding with salt loss for a lot of dehydration cases. We mainly see that salt leaves the body with sweat, so we see that electrolyte loss is mainly going to go along with dehydration. Treatment is going to require replacement of the fluid, obviously, but also replacement of those electrolytes that were lost, so restoration of the normal salt content. Dehydration is going to affect the body in many different ways. It can result from excess heat. It can result from excessive water loss during exercise, or from things like burns, restricted water intake, very hot environments with restricted water intake. Most common cause of dehydration is going to be the failure to drink liquids over an adequate period of time. Our average person is going to lose approximately 2.5% of their total body water per day. So losing 2.5% means that only after a few days you'll lose close to 10% of your total body water, which is a insurmountable amount. So not going to be able to come back from that, and usually that will result in death. We lose our water in the urine through insensible perspiration from the gastrointestinal tract and through sensible perspiration and expired air. We also see that in terms of water loss for sickness, especially from the body, we have vomiting and diarrhea from acute sickness that can cause excessive water loss and electrolyte loss. Preserving fluid balance, especially during physical performance, is going to be key. Finding a replacement recommendation for athletes is a little bit difficult because of the fact that strength athletes and endurance athletes have different protocols, but there are standards for both surrounding periods for before, during, and after physical activity. In this one study mentioned here, the X-ray computed tomography suggested a decrease in ventricular size of the brain following dehydration, so they have an acute cognitive decline. Also, MRI imaging showed that during dehydration and restricted fluid intake, the total brain volume was actually reduced. So this is an effect that could be reversed following acute rehydration, meaning that brain size actually diminishes in response to dehydration, as well as brain function. Dehydration is going to elicit a significant impairment on cognitive performance, especially if severe dehydration persists. Some of our dehydration symptoms, all right, we see dry mouth, less frequent urination, dry skin, thirst, headache, and rapid heartbeat, tachycardia, just to mention a few. Also, the feelings of faintness doesn't mention things like cognitive decline, confusion. Dehydration is markedly going to affect almost all systems, especially renal output and the brain and cognitive ability. Speaking of that, dehydration is shown to markedly affect executive functions and attention requiring tasks to a greater degree than anything else. So tasks requiring attention and executive function are significantly more impaired after dehydration onset. The same study witnessed that other processes like reaction times or memory, things that were already learned, are not nearly as inhibited as those executive decision-making and attention processes. Those are higher order processes, indicating that the more complex cognitive processing can be impaired by dehydration as well. So getting into dehydration and exercise, dehydration is going to have a marked impact on all exercise performance, not just endurance, not just resistance, not just a combination of the two. We see that pre-exercise body weight loss at or above 3% may decrease subsequent endurance performance. That was in a study by Goulet in 2012. Recommendation for endurance athletes is to get approximately 5 to 10 milliliters of fluid or water per kilogram of body weight at least 2 hours prior to exercising. In exercise sessions that last for an hour or less, usually dehydration does not really decrease endurance performance. However, lasting longer than an hour, we do see a significant decline. So fluid needs to be taken in. And it was marked that fluid intake, according to drinking and thirst, will actually maximize endurance performance. It's recommended that we intake fluid to maintain a body weight loss of only around 2 to 3% during exercise if we want to keep consistent output. So in this graphic on the right here, we see effective dehydration. We're going to see that at a fully hydrated state, we have maximum performance. And then we have the sensation of thirst, which is going to be induced when we lose greater than 2% of our body water loss. So the percentage of body water loss as a percentage of body weight. When we get into 4 to 6%, we see reduced muscle strength, and 6 to 8% is going to lead to severe cramping and heat stroke / heat exhaustion. So when exercise is going to be leading to induced dehydration, we see that anything greater than a 2% body weight loss is going to impair endurance performance. And athletes should be able to drink before they become thirsty to maximize endurance performance, because on the onset of thirst, usually that's too late. Dehydration is also going to augment hyperthermia, so in really hot, warm climates, obviously sweating and perspiration is going to increase, so dehydration onsets a lot faster. So fluid intake needs to be markedly higher during those environments, as both sweating and skin blood flow are going to be higher during this time. So we enhance our sweating and insensible water loss to make dehydration much more likely in warm climates. Some of our consequences of dehydration is illustrated here by our graphic. We have increased risk of hospitalization, affected mental performance, lowering of blood pressure and blood volume, acute kidney injury, especially digestive issues and urinary tract infection, and pressure ulcers. So dehydration during exercise is going to inhibit exercise performance above greater than 2% body weight loss from water loss. Dehydration from sweat losses is going to increase plasma osmolality, meaning that we have a greater solute concentration in the blood plasma than if we just had a full body hydration status. So this is going to decrease the plasma volume of fluid, leading to a greater amount of solute in the plasma of the blood. Hyperthermia alone is going to cause many different symptoms: cardiovascular strain, altered metabolism, altering central nervous system activity, and attenuation of muscle force generation. So if we practice in an environment where hyperthermia is already likely to onset, being an extremely warm or very hot environment, then dehydration plus hyperthermia is only going to compound the issues. So we have to determine whether performance deficits are a result of hyperthermia if it's a very hot environment, or if it's a result of dehydration. But most likely it is going to be a result of both of those things. An example of this is we see that marathon performance is progressively degraded with an increasing environmental heat stress. So the warmer the environment that a marathon is competed in, the less likely that the athletes are to perform at their best. Future research for dehydration direction. In a couple of the studies that I looked at, we saw that there were some deviations in previous research, especially in the blinding of participants. So I looked for future protocols to not make the same mistakes as previous protocols on hydration status. So we actually do want to blind the participants, so that prevents the bias and the cognitive outcomes that we see. So the effect of fluid intake on thirst is also seen to inhibit dehydration sensing by the body. So if we can negate this by routing the hydration of the body into another mechanism, such as intravenous injection, that will circumvent the traditional oral intake and will also change the body's thirst sensation. So that will potentially lead to more accurate results. We see an example of this in the study by Adams, where the mechanism of fluid intake was not standard ingestion. It was actually just intravenous infusion of a saline solution during exercise, and that could potentially yield more accurate results. So hydration taken via tubal administration and not orally can potentially negate the thirst response. Additionally, another note was that several of the studies I researched did not have a control group, or they lacked a real-life mimicking group, so to speak, where they had two groups experimentally, but there wasn't a third group where they were just allowing athletes to compete and take in fluid at their own discretion. So future studies potentially need to proceed with control groups to compare results to, with two experimental groups that receive hydration at a standardized dosage. So the control group would need to be allowed to take in fluid orally ad libitum to mimic real-world practices during activity, and that would help with getting reliable and accurate results. All right, and that is my symposium on dehydration and how dehydration affects exercise. Here are my references for the studies if any of you would like to go and take a look and read some of these on dehydration and the dehydration effect on cognitive ability, exercise, cognitive performance, and during heat stress. Thank you all so much, and take care.